Diabetes is a chronic condition that affects more than 30% of the adult population in the United States and more than 400 million people worldwide. To properly understand diabetes, we need to take a look at the processes that are disrupted. Glucose is the main fuel source of the body. Together with oxygen, glucose is utilized by the mitochondria in cellular respiration via the Krebs citric acid cycle to create the high-energy bonds of adenosine triphosphate, or ATP. ATP is the molecule that powers most of the functions of the cells within the body. While other sources of power are available to the cell, none are as efficient as aerobic cellular respiration and the end product of ATP. For diabetes, the primary organ of consideration is the pancreas. The pancreas secretes both insulin and glucagon. Insulin is a hormone that facilitates the movement of glucose across the cellular membrane and into cells. Glucagon is secreted by the pancreas and utilized by the liver. Glucagon causes the liver to release glucose into the bloodstream, partly through the breakdown of glycogen, a fatty acid made up of a string of glucose molecules. Insulin is secreted by the beta cells in the islets of Langerhans within the pancreas. Glucagon is released by alpha cells, also found in the islets of Langerhans. Most of the effects of diabetes result from a dysfunction related to insulin. Let's look at the normal action of insulin. The cell needs the glucose that is outside the cell. To allow the glucose to enter, insulin must signal a receptor within the cellular membrane. Insulin binds with the insulin receptor, which in turn signals a vesicle containing glucose gates to the cellular membrane. Now the glucose gates are on the surface and available to transport glucose into the cell. This transportation lowers the amount of circulating glucose and brings the major energy source into the cells. Insulin must be present to open the glucose gates into the cell. Insulin does not itself move into the cell, but potassium does accompany glucose through the glucose gates. Now that we've examined the normal functioning of glucose transport, we can start to look at the disease processes that disrupt the normal function. We're going to focus on two different but related forms of diabetes. There are subtypes of type 1 diabetes. Idiopathic type 1 diabetes is a relatively rare subtype with a strong genetic component. It occurs primarily in individuals of Asian or African descent. Given its relatively rare occurrence, we will focus on the much more common autoimmune form of the disease. The autoimmune form of the disease is a progressive state in which the individual's immune system fails to recognize the beta cells within the pancreas as self. It slowly attacks and destroys the beta cells that produce insulin. The beta cells will eventually fail to produce enough insulin to effectively move blood glucose into the cells. Once 80 to 90% of the beta cells have been destroyed, these individuals will start to have hyperglycemia and may have symptoms of cellular starvation. Type 1 diabetes generally presents in childhood. These patients represent about 10% of all diabetics. When diagnosed, these patients must be placed on exogenous insulin to treat the condition. The mechanism that causes type 2 diabetes is very different than type 1. Through a process that is poorly understood, the cells build up a resistance to insulin. That resistance means an ever-increasing amount of insulin is required to move the glucose into the cells. The beta cells grow to meet this need, even dividing and making more cells. But they push too hard and eventually die. For these individuals, they end up with a shortage of insulin and resistance to the insulin they do have. Unlike type 1 diabetes, type 2 is generally diagnosed well into adulthood. The processes related to insulin resistance take time to develop. This form of diabetes accounts for over 90% of all diabetics. Being overweight, especially when fat storage is mainly in the abdomen, A lack of physical activity, family history of diabetes, and high levels of cholesterol are all risk factors for diabetes. Early treatment for diabetes is usually focused on diet change and exercise. These are also the most effective forms of treatment. PO, injectable, and insulin medications can be used to treat type 2 diabetes. The major damage done to the body by both types of diabetes is due to hyperglycemia. The term hyperglycemia can be broken up into parts that mean elevated glucose and blood. It is high levels of glucose sugar in the bloodstream that causes problems. Hyperglycemia causes long-term problems that damage blood vessels and lead to some serious complications. Let's examine one of the effects of hyperglycemia. Here we have a blood vessel, glucose molecules inside the bloodstream, and water can be found both inside and outside the blood vessel. Glucose exerts osmotic pressure on water. This means that the high concentration of glucose in the blood pulls water into the bloodstream. This has some important effects on the body. The extra water in the bloodstream, created by the osmotic effect of glucose, leads the kidneys to excrete more water than they would otherwise. The increased urine is called polyuria. The loss of water increases the sensation of thirst. The increased thirst is called polydipsia. Another effect of hyperglycemia is that the kidneys excrete an increased amount of glucose in the urine. This finding is highly suggestive of diabetes and is called glucoseuria. An important symptom of diabetes, not related to the osmotic effect of glucose, is the result of a glucose shortage within the cells. The cells are requesting more energy from the body, and the body recognizes this need as hunger. Polyphagia is excessive hunger or eating. Together, these are the classic symptoms of uncontrolled diabetes. These symptoms will often lead to the diagnosis of diabetes by a healthcare provider. Other symptoms of hyperglycemia include vision changes, weakness, and dry mouth. Low blood glucose is the opposite of hyperglycemia and can occur in diabetics because the glucose management is not working correctly. We call this condition hypoglycemia, meaning low levels of glucose in the blood. The symptoms of hypoglycemia are a result of the energy shortage in the cells. Irritability, confusion, anxiety, sweating, abnormally pale skin or pallor, fatigue, and sleepiness are all associated with hypoglycemia. Diabetes can be diagnosed using a few different lab tests. These all require a blood sample. A fasting blood glucose is a glucose level drawn on a patient after an overnight fast. Generally, diabetes lab results will be divided into normal ranges, prediabetes, in which the patient is at risk of progressing to diabetes, and diabetes. In the case of fasting blood glucose, a result greater than 126 milligrams per deciliter suggests diabetes. The result must be duplicated on another day to diagnose diabetes. A random glucose is a non-fasting glucose. A result of greater than 200 milligrams per deciliter suggests diabetes. The oral glucose tolerance test is a test commonly used to identify gestational diabetes, a form of diabetes that can occur in pregnancy. For this test, the patient drinks a sugar-rich drink. A blood test is done 2 hours later. A finding of greater than 200 milligrams per deciliter is suggestive of diabetes. A glycated hemoglobin, or A1C test, provides a value that indicates the average blood glucose for the last 2 to 3 months. This has to do with the way that glucose binds to red blood cells. This test is the gold standard for diagnosing diabetes. A finding of greater than 6.4% is diagnostic for diabetes. We discussed some of the symptoms that hyperglycemia can cause, but the damage caused by diabetes can be severe in the long term. All types of diabetes can lead to acute and chronic problems. The acute problems are related to hypoglycemia or hyperglycemic emergencies like diabetic ketoacidosis or hyperosmolar hyperglycemic state. Chronic hyperglycemia causes an inflammatory process that damages blood vessels as well as peripheral nerves. Diabetes will directly cause damage to the retina of the eye or retinopathy, a leading cause of blindness, damage to the kidneys or nephropathy, and a leading cause of kidney failure. The most common complication is damage to the nerve endings in the periphery. This typically causes numbness with tingling or pain to the feet and legs. Diabetes is also a significant risk factor for stroke, ischemic heart disease, pressure ulcers, and difficult to treat infections that can lead to amputation. Diabetes is a common disease that is only becoming more prevalent worldwide. Understanding and recognizing the symptoms of diabetes is essential for providing excellent care for our patients.